Music therapy is one of the creative arts therapies, so it uses music as a medium to help people in different areas. So to improve health and well-being, for example, you can use it to improve language and communication, to address emotional needs or behavioural issues, to help with physical skills or with cognitive skills. So it's quite a broad therapy. It can be used in many different areas. And this is mainly because music, we now know that music affects all parts of the brain simultaneously. Oh. So it really is a mega vitamin for the brain. So at the same time, while it's affecting the area of the brain that deals with language and communication, it's also affecting the brain that deals with our physical skills or the emotional area of the brain. So when we're listening to music, for example, all parts of the brain light up. You know, they're all stimulated at the same time. Because we know that music, you know, affects the brain in a very deep kind of a way. You know, even people who are in lower awareness states, for example, you can make a connection with them through music. And often, you know, you may have a client who does not respond to anything else. You know, they may not be able to interact with you verbally, but through music you can make a very definite connection with that client, and you know, there's an interaction taking place on a musical level. So it's like a musical dialogue. Wow. The music therapists work with older adults with dementia, in special education, you know, children with autism, children with profound multiple learning disabilities. You know, music therapists also work with people in mental health settings. So, you know, you can find music therapists working with, you know, people with all different kinds of diagnosis and many different kinds of clinical settings.
Why use music?
Well, music is a medium that's accessible to everybody. So regardless of your age, regardless of what culture you come from, you know, regardless of your language communication ability, your physical ability, you know, anyone can access music. So basically it transcends all those other boundaries that, you know, that may be there. And because, you know, like I mentioned earlier, music does, you know, affect the brain in so many different ways, that music therapists use music on completely different levels. So it may be that, you know, music offers a way for people to, you know, express things that they may find difficult to verbalise, you know, their feelings or traumas that they may have experienced. But also there's quite a functional element of using music. You know, for example, in neurological disorders, or, you know, for example, with acquired brain injury, I can think of a really good example. You know, everybody is familiar with Gabby Gifford. She was an American congresswoman who was shot in the head, and as part of her rehabilitation, music therapy was used to aid her language and communication. And this, you know, this was quite functional element of music therapy, because we now know that music can rebuild the neural pathways in the brain. So, for example, with Gabby Gifford, the neural pathways to do with language and communication would have been damaged when she was shot in the head. But through music, she was able to rebuild these and, you know, relearn how to talk, basically. So the sort of thing that might happen in a music therapy session, it really depends on the context and the client that you're working with. What usually happens is the client is referred for music therapy, and more often than not they're referred by somebody else, but they can also self-refer, depending on the situation and the context. So once the music therapist receives a referral, they'll meet the client to conduct an assessment. And then after this assessment period, they will usually, you know, they'll write a assessment report saying, you know, if music therapy is to continue, you know, what therapy objectives can be met, you know, what will they work towards. So, you know, just to give different examples of what might happen, depending again on who you're working with, the therapist will employ different techniques and different things that they may use. They may, for example, use improvisation, where both the therapist and the client will actively engage in music making. So they may use instruments, or they may use voice. Again, it depends on what the client is more comfortable with. In other contexts, they may listen to music. They may analyse the music that they're listening to. They may analyse song lyrics, for example, because this may communicate something for the client that maybe they cannot or do not want to verbalise. For example, there's also therapeutic songwriting, which is another way, to express what's inside. And really, all of these different techniques are all just ways that you can bring what's inside outside. It's exploring the inner world of the client and expressing this through the music. One question that people often ask is, do you need to have some prior musical experience to benefit from music therapy intervention? And the answer to that one is no. As music therapists, we believe that everybody is musical. It's something that's innate within humans. So, for example, if you look at a little child, they're singing basically before they start to talk. It's quite musical. So, music is something that we have innately within us. So you definitely do not need to have any prior musical experience, ability or, to benefit from music therapy. And the other thing that's very important as well is that within music therapy, all sounds have meaning. So from that point of view, there's no right notes and there's no wrong notes. Everything, all the music that's produced or anything that's made, whether it's through instruments or through the voice, it all has meaning. And, a lot of the time within a music therapy context, you're bringing out what's inside the client, through the music. So the music therapy is like shining a light into their world, and they're expressing what's inside, whether it's through their voice, whether it's through instruments. So from that point of view, there is no right or wrong notes. Sometimes there are misconceptions about what music therapy is, and one popular misconception may be that, for example, your child is going to learn how to play music within a music therapy session. Basically, this may happen as a byproduct of the therapy process, but it's definitely not where the focus is, unless, of course, there is a therapeutic outcome for something like that. Music therapy is always first and foremost about using music to help the client address needs in whatever area it may be to improve their own health and well-being. So whether it be in the area of language and communication, or to address emotional issues, or cognitive issues, whatever area it is, it's using music to help them in that area and to improve their health and well-being in that area.
Tell me a bit about the history of music therapy.
Yeah, well, music, throughout all cultures in the world, has been used for healing in different ways for centuries. People have long known about the healing properties of music, but really, in the modern sense of the word, music therapy as a profession here in the UK has evolved really since post-World War II, and actually, what happened was a lot of soldiers returning from the war were quite traumatised and found it very difficult to verbalise, their feelings around the trauma that they had experienced. And they found that music actually was, offered an alternative way, a non-verbal way for them to express their emotions around, their traumatic experiences. And, really since World War II, music therapy has developed as the profession it is today. Music therapists usually have a primary degree in either music or psychology. And then you have to go and do a postgraduate qualification, which is usually a 2-year MA programme in music therapy. And there are a number of courses in the UK that you can do for this. And then when you finish that, you become registered with the Health and Care Professions Council. And this is very important. So since the 1990s, music therapists and all creative arts therapists would have to become registered with the Health and Care Professions Council in order to practice as a music therapist and to use that title. So it is a protected title. And the reason why this is so important is because you agree to abide by their code of ethics, and this protects the clients that you're working with, and it also protects the therapist as well, and it ensures high standards of practice.
Yes. And if somebody wants to find a music therapist,
Yeah.
how do they do that?
Well, the very good place to start is the British Association of Music Therapy. So they have a website, and you can also contact them. Their contact details are on the website, and they can direct you to music therapists in your area. And their website address is www.bamt.org.
What do you love about music therapy?
Well, I became a music therapist a number of years ago because I was just so intrigued by the way music can work, you know, to help people in different areas and on so many different levels. So in my own work, you know, I've used music on completely different levels and in different ways. You know, I've used music functionally to help people, use music from a social point of view to help people just interact and have that sense of belonging, you know, within a social context, and also, you know, emotionally, you know, using music to help people emotionally. And that's, for me, that's the beauty about music. It works on so many different levels, and, you know, it's something very special because it happens there in the moment, in that moment in time and within that context. And in my own work, I see that most clearly, I think, working with people with dementia, you know, because usually their daily lives are somewhat chaotic, you know, they're quite disorientated, you know, for much of the time, but within the context of the music therapy session, they actually come into that moment in that time, within that context. And for me, you know, the music therapy has the potential to give them back something of themselves. It's an opportunity for them to reconnect with who they are, you know, get back part of their identity, which is often quite lost in their normal chaotic daily experiences. And it's something very, very special. It's very, very special. And, you know, often I've worked with family members as well, you know, when working with people with dementia. And it's something so beautiful for them to experience as well. You know, just that opportunity to be able to reconnect with a loved one, you know, within the context of the music therapy session. Something very special. And, you know, other examples, you know, working with children, for example, with profound and multiple learning disabilities, you know, just to see that the joy that music brings to them, you know, it's amazing. You know, often they may not connect, you know, in any other way. You know, so music is one way that they can really make a connection with you, and, you know, to see the responses that you get, you know, and the musical interaction that goes on, it's fantastic. It really is. You know, working, I used to work in a children's hospice, so working with, you know, some children who have quite low awareness states, who were not responding to anything else, but, you know, could respond to music because, you know, as we said, music goes very deep within the psyche, and, you know, to some levels that we still don't really fully understand, you know, but to be able to make a connection with someone in that low awareness state, it's something quite profound and, yeah, truly, truly amazing.